This episode is brought to you by the American Red Cross. The start of the new year is one of the most challenging times to collect blood products. Severe winter weather can often lead to widespread blood drive cancellations. But you can be the life-saving difference this January and make an appointment to give now. In the hour it takes to donate blood, you can help save the lives of patients in Denver and across the country. To download the Red Cross Blood Donor app, visit redcrossblood.org or call 1-800-RED-CROSS to make an appointment. Today on CityCast Denver. Last week, Colorado filed yet another lawsuit against President Trump, this time over the administration's freezing of funding for childcare and low-income family support programs. While a judge has granted a temporary restraining order on the freeze, early childhood education advocates say the funding situation is still precarious. I'm sitting down with Mathu Subramanian with the Colorado Children's Campaign to understand how these looming cuts could impact Denverites beyond just families with young kids. Today is Thursday, January 15th. I'm Bree Davies, and here's what Denver's talking about. Mathu Subramanian, welcome to CityCast Denver.
Thank you so much for having me, Bree. I'm excited to be here.
So last week, President Trump ordered this freeze on childcare funding for Colorado, along with several other Democrat-run states. And we're going to get into what that all means in a minute. But first, the latest news is that a judge has temporarily blocked this funding freeze. What does that mean?
Yeah, that's a great question. So the freeze affects 5 states, including Colorado. So the 5 states brought a suit against the administration to temporarily block the order. So what that means is for the 14 days since Friday, when the court order went into effect, the Trump administration cannot block the federal funding to our state. And so that includes TANF, childcare dollars, and social services grants, which is it affects the foster care system and child welfare. So the reason that we filed for a temporary restraining order is because the long-term advocacy plan, as I understand it, is to file for a preliminary injunction, which would prevent the funds from being frozen permanently. That case takes a little bit longer. And so this 14-day TRO is designed to tide us over until that case can go through.
So it's sort of like a pause on the order so that a case can be put, there's time to get something together to sort of push back or fight back. I don't know if that's the best way to describe it.
No, that's exactly right. That's exactly right. Because if we hadn't filed this, we wouldn't be getting money now while we waited for the court case to go through. So we want to make sure the services continue. So this is buying us time, essentially, exactly as you said.
Buying us time. Okay, that's perfect. And I do just want to clarify, you said TANF, which is Temporary Assistance for Needy Families, which is another program that potentially could be impacted by these freezes that supports low-income families.
Yes, and that also includes a separate stream of childcare dollars. So when we're talking about childcare being funded, we're talking about all 3 of these funding streams have some childcare money in them.
Okay, let's talk about what's at risk then, because in Colorado, what's at risk with this potential freeze is more than $100 million just this year in funding for the Colorado Child Care Assistance Program, or CCAP. What is CCAP?
CCAP, as you said, it's the Colorado Child Care Assistance Program, and it comes from a child care block grant that goes out to all of the states from the federal government. This money is given to low-income families to help support their child care needs. And so actually, although it goes to low-income families, there's 2 ways you can do it. You can do it through giving families vouchers, or you can pay providers directly. So here in Colorado, we paid providers directly. So what that means is if a family is eligible for CCAP, they are able to find a provider that accepts CCAP, and then that provider will take their kids. So the reason that this funding freeze is really detrimental, not just to the low-income families that the subsidy serves, is that most providers in Colorado don't only have kids who take CCAP. And in fact, many families in Colorado send their kids to providers who take CCAP, but they may be paying like the full private pay amount. So if this funding goes away, though, these providers won't be able to stay open. So not only will this affect the low-income families who get this subsidy, it will also affect the entire ecosystem because providers who take private pay kids may have to close without the funding.
Okay, I think my family's sort of in this situation exactly. Is like, I believe we pay full tuition for childcare, but because our school uh, accepts CCAP dollars, if those dollars are taken away, the school may not be able to function because that's obviously part of their budget. So it's a little. I'm thinking of it in the way that people think of housing vouchers. So if you get a voucher for affordable housing, it's like you get a coupon essentially. You take it to a how you take it to a landlord and you say, I'm going to pay with this. This way is different in that the child care provider gets that money directly from the state to subsidize those other kids. So if they don't have that money, they may not be able to just pay their basic bills because, say, I don't know, half of their funding is gone.
Exactly, exactly. And I think something important to remember too is that childcare providers are very underpaid. So there are many providers that are actually on benefits themselves. I mean, it's in Colorado, I believe it's close to half of folks who work in childcare are on some kind of public benefit because their salary doesn't pay a living wage. So this might be owners like family childcare homes or small businesses, or this might be like, the teachers who your kids love who are in the classroom every day. And so if we lose this childcare money, we are going to be actually affecting Colorado's poorest residents in two ways, both by taking away their childcare and in some cases, in the case of providers, taking away their jobs also, right? Then you have this added layer of folks who are on temporary assistance for needy families who have work requirements. Well, if their child care dollars are gone, they're not going to be able to go to work. And then they're not going to keep receiving their benefits. So it's like this vicious cycle that affects pretty much everybody involved in the childcare system.
And it sort of sounds like a domino effect in that you're saying, okay, if the child care funding dollars disappear, that means that kid doesn't have child care. So that parent may be pulled out of the workforce. Obviously, someone has to take care of their kid, and then it sort of goes from there. It can impact them in multiple ways and communities in multiple ways.
That's absolutely true. That's absolutely true. And every year Colorado loses almost $4 billion in revenue because parents can't go to work because they have to stay home with their kids. That's the gap because of unemployment, because of childcare. So to put that in perspective, our state is in a budget crisis right now. And our legislators were asked to cut, and departments were asked to cut $1 billion from the Colorado budget. Well, if we had childcare for everybody, I mean, we wouldn't have that loss because we would have this $4 billion in the economy. That number is just going to get larger as this freeze continues, right? And as people lose their childcares and lose their providers.
So I can see where, because that's the thing I really wanted to bring it home to is even if you don't have children in childcare, either you don't have kids at all or your kids are, older than that, it still could impact you and your community based on things like tax dollars not coming in because those parents are not contributing to it because they're not able to work.
Absolutely. Absolutely. We're seeing cuts in the system now and across the budget during this budget season that's going to affect everyone. So even if you don't have a child in childcare, if people in your community can't work, then your community is losing revenue for things like keeping your roads free of potholes and funding your neighborhood school, right? So this doesn't just affect people with children, it affects all of us.
Yeah, it's so interesting because, obviously on its face, it sounds scary, kids not having childcare, but to help put it in more practical terms, it really has a wider impact on the community. I'm thinking about childcare as a profession, right? You kind of mentioned this, like childcare centers are also employers in our community. I myself worked at a childcare facility as a teenager, and it was a small business run by a woman and her family. And I know the school where my son goes now employs single moms, folks from the trans community, people of color. It's a really diverse workforce, but this is also a field of study. It's also a career path. What's going on right now for folks who maybe are interested in a career in early childhood education?
That's a great question. And that's actually something we have in common because when I was 15, I worked at a daycare center. That was my summer job. So I also have a past in childcare work. So childcare providers are almost exclusively women of color. And so they're often some of the most marginalized folks in society. Right now, on top of all of the cuts that are happening, the administration has also made new rules around Pell Grants. So Pell Grants are loans that you get to go to college or grad school, right? And right now there's a new rule that if you don't make a certain amount of money, or you're not projected to make a certain amount of money after you graduate, you will not be given a Pell Grant. So that's attached to certain fields. So one of the fields that that's attached to is early childhood. So right now, you are not able to get a Pell Grant to go to school if you want to study to be an early childhood professional. If our childcare centers shut down, that's kind of the only place right now where you can get a childcare license because you apprentice there, right? If your family can't afford to pay your tuition, you're not going to be able to go to school to get a degree for early childhood. So that's going to affect the quality of our system. That's going to affect the early childhood pipeline. And if providers shut down, that's going to affect the number of jobs in our community. So this really is going to have an effect for years to come if this freeze goes through.
Okay, let's go back to the potential cuts to the funding itself. What do these potential cuts to programs like CCAP mean practically for children? Like, I'm thinking about, this is early stages, crucial stages of early development. This is children, 6 months to 5 years old, who are often in this childcare situation. What happens when this type of not only daycare support, but also education is no longer accessible?
So one of the reasons that I feel so passionately about early childhood and I'm in this field is because between the ages of 0 and 5, our brains develop at a rate that they don't at any other time in our lives. Like, if you think about it, between the ages of 0 and 5, you just learn how to be a human, right? You learn how to tie your shoe. You learn how to button your shirt. You learn how to count to 10. You start to learn how to read. And so for a kid that age, any kind of childcare setting, whether it's explicitly a Head Start or a preschool or just a childcare center, is a place where they learn. And we know that investing in education and care services for kids 0 to 5 has benefits throughout the lifetime, right? So if we take away this funding and these kids aren't getting the services, we're going to have a generation of kids that might have the lower high school graduation rates than kids who do get these services, or college graduation rates. They might have higher incarceration rates than kids who do get this kind of service. And if I can tell a personal story, so my kid was one of the kids who missed out on preschool before she went to kindergarten. So her kindergarten year was 2021, and she and her classmates were just feral. And they only missed like 1 year of preschool, right? They missed that key year of development. So now imagine kids just missing out on that entirely. And we're going to have a whole generation of kids who are just going to need a lot more social services and are not going to contribute as much to our economy. And to me, the most important thing, are just not going to be as happy and healthy and productive as they could have been if they had had these interventions.
So you're saying your kid it was the COVID effect, right? Is like,
yes,
kids were not in school. And I know a lot of parents can relate to how that impacted their children, regardless of the age they were. But I see what you're saying, because sure, like, they can be home with you or your family members, and but I think about the things that my son learns at school, which is also a daycare, and he's been going there since he was 2.5, so it was almost preschool. But there's things that I wouldn't even know to teach. I mean, that's where I think the early childhood education component comes in. Is it's not just daycare where your child is safe, like you're saying. They're learning a lot of things that we might not even think to teach them as parents or caregivers at home.
Completely. And that we shouldn't be teaching them necessarily, right? Like, I don't need my kid to raise her hand when she has a question at dinner, right? But that's something she needs to know to be successful in school, right? So her class, for example, it was really hard to get them to learn how to line up because a lot of them had never lined up before, right? So there's all these aspects of school readiness that kids learn at a daycare center that they're just not going to learn at home. Or, my kid's an only child and she's a little older for a class. She got at least a year of preschool. And that's where she learned to share. That's where she learned to interact with people. That's where she learned to sit quietly and listen to a story, right?
Yeah.
So these are all things that kids are going to miss out on. And, as a former public school teacher, I can tell you all of those skills are super important for teachers so that they can just get into the academics of it and not spend so much time prepping kids for school readiness.
I'm also just thinking about my son, again, started at 2.5, and we were potty training. And his teacher said to me, honestly, you know what? Part of the success here is peer pressure can be a good thing sometimes. And so when he's at school and he's seeing other kids use the bathroom, it made it, it sort of helped us along in the process to be like, do you want to still be a baby who's peeing in your diaper? No, you don't. You want to be like the other kids in your class. So it's like, I see where the socialization stuff can be, as simple as, not as simple, but like something like learning to share, but also practical things that they need to learn how to do, like use the bathroom.
Completely. And also, to go back to we want our kids to grow up happy and healthy and to just like be kids, right? You learn how to emotionally regulate. You learn how to not take things personally. You learn, how to label and manage your emotions. You learn to look at somebody's face and figure out what emotions they're having. And if you're a kid who's on the autism spectrum, or if you're a kid who has any other kind of neurodiversity, you start to realize how to ask for help and how to do all of these things. Like value yourself and the things that you bring to a situation that you wouldn't necessarily learn just being at home.
Yeah. And I'm also thinking about teachers are taught to observe certain things where, like at my son's school, they might bring in special therapists that integrate into the classroom. So they're not taking kids out of the classroom to teach them something, but that might be where you discover from your teacher's observations that your kid is on the spectrum. There might be things that the teachers are looking for because they're trained to that you won't see at home. So it's just interesting to think about all the things we didn't realize we learned in preschool.
Yeah, and I think the point you're making is so good too, because a lot of what happens in daycare centers is that people who are trained to know what child development looks like can pick up on developmental delays before they become an issue, right? So a lot of early intervention is things like, speech pathology or occupational therapy. So it's not even just for kids who are neurodiverse. And these are all things that, again, help kids throughout a lifetime and help them to keep from falling behind in school and just in keeping up with their peers. So I think it's so important what you're saying too, because I think there's this idea that anyone can just walk into a daycare center and like be a teacher, but it really is a skilled job that just benefits all of us in so many ways.
This episode is brought to you by Denver Health. As the backbone of this city for 165 years, they are Denver's most trusted. Denver Health is more than a hospital, more than a doctor, more than a treatment. They are a community. Denver Health is your neighbor, your champion. They offer emergency care, urgent care, and primary care, as well as healthcare in more than 130 other specialties. Most major insurance types are accepted. Oh, and did you know this summer, Denver Health is bringing care closer to home with the opening of the Denver Health Southeast Medical Center at the corner of Evans and Monaco. Serving adult patients, this new clinic will feature adult primary care and specialty care services. Denver Health, with you for life's journey. To find trusted healthcare near you, visit denverhealth.org/citycast for more information. That's denverhealth.org/citycast. Did you know CityCast Denver has a perks program? Every week, we're highlighting some standout deals from our favorite businesses in town to help you support local and save some money. It's a win-win. Here are some highlights from this week. Check out Meow Wolf's Adultiverse Space Rodeo on January 17th and experience the worlds of Meow Wolf Denver transformed into a 21 and up psychedelic party. Saddle up for an intergalactic adventure. Just use code GIDDYUP for $4.20 off an Adultiverse ticket. Offer available for redemption now through January 17th. Or what about Topo Designs? Just visit a Topo Designs retail store and mention this ad to receive 20% off your purchase. Some exclusions apply. Valid until February 1st. Looking for some fun? Check out Green Door and pre-order a curated cannabis box for your Denver trip. Includes edibles, snacks, and local accessories, ready for pickup near your stay. No stress, no lines, just a better trip. Use code DenverPerk for $10 off any experience box. To see a full list of participating businesses, just visit denver.citycast.fm/perks. It's a great way to check out new restaurants, shops, and events in the Mile High City without breaking your budget. And I love that for you. Let's get back to the money part, the funding part. So say this, the injunction, the time passes and states do end up losing this funding. What does that mean for the next, say, year? Like what would we see impact-wise?
It would be devastating. honestly. I think our early childhood ecosystem would just collapse because many of our providers could not survive without the money they get from both childcare subsidies through CCAP and through TANF. I think we would have a real spike in child welfare cases. We know that childcare is one of the best ways to prevent child abuse and neglect. And access to childcare helps families not only find safe places for their kids to stay, but also helps them do things like work and have time to regulate their emotions. So it's super important in that area. I think we're going to see people lose their benefits. TANF and Medicaid both have work requirements, which you can't do if you don't have childcare. Many of us don't have jobs where we can just bring our kid to work to sit in the corner while we're on a Zoom call, right? So all of those areas are going to get affected by this. So really, I don't see I don't see the freeze as an option because it would just have an absolutely devastating effect on our state.
Do we know if the state is trying to do anything at the moment to stem it? I mean, I know obviously we're in the midst of a budget crisis ourselves as a state and here in the city of Denver. Is there anything that's being done, or is there anything that can be done to make up this, $100+ million funding gap?
So right now, our attorney general has joined with the 4 other states in the funding freezes to continue to file legal actions against the funding. And that's sort of the most effective and immediate thing that we can do. But I believe that there is sort of a renewed conversation among advocates and at the state level about the need for Colorado to invest more money in this system. Talking to other states who are going through the freeze right now, they have backup capital because they invest more in their state systems. Right now, we only invest about $30 million in our state system. And I personally would really like to see more investment on the state level. We have a lot of great investment in UPK and preschool, and that's an amazing start. And we've come so far in a short amount of time.
UPK is the universal preschool. Is that the universal preschool kindergarten program? Universal? What is that one?
Yeah, so it's
sorry,
it's confusing. We call it the universal preschool program. In other states, UPK stands for universal pre-kindergarten. Here we call it universal preschool. But yes, it's for all 4-year-olds in the state, and all 4-year-olds can receive up to 15 hours. And if you have some qualifying factors like income, for example, you can receive up to 30 hours. But even those kids, parents work for more than 30 hours a week, right? So even those kids are often receiving CCAP for the extra childcare kind of hours.
So that's how, because universal preschool is something that Governor Polis, that was recent, something that he did in the last couple of years.
Yep.
But that program could still be impacted, you're saying, too, because of kids also needing the CCAP funding to cover the rest of the time. Because like you said, universal preschool only covers a certain amount of hours. Again, most parents are working more than 15 hours a week. So kids in those programs could also be impacted.
Completely. And not only that, but, all of our licensing folks who are important for like the quality of programs and keeping programs going are paid through these childcare funds. So there's a lot of kind of back end work that's happening through this funding. So I don't want this to be like everybody who has a kid in UPK starts panicking because like you're good for now. It's definitely not the same effect as a CCAP freeze, but it does affect our entire system. And I was talking to Casey, who's the head of the Early Childhood Council in Boulder, and she interviewed some of her providers, and she had a Head Start provider that estimated that she would lose about $40,000 because of this freeze. She had another provider that does a mixed group of CCAP kids and for private pay kids who would lose about $10,000. So, this is just going to affect providers in general, right? So as you're saying, if you're a provider who does UPK but also takes CCAP and you're not getting your CCAP money, you may have to close your whole center. So even your UPK kids are not going to get money.
So this whole thing, this beginning of the situation stems from these accusations of fraud in the childcare system in Minnesota. This is something that's not just affecting Colorado. Part of the reason that the Trump administration decided to take this step because they were looking into issues or allegations of issues of fraud in the childcare system in Minnesota. But I'm looking at Colorado. I understand fraud can happen in any industry, but is fraud a potential problem here within Colorado's childcare system?
Yeah, that's a great question. So Colorado has some of the strongest anti-fraud measures in place in the country. So it is very unlikely that there is fraud happening in our system. And in fact, in conversations with our Department of Early Childhood, they have told me that they were able to gather all the materials quite quickly in comparison to other states because we have such intense record keeping and such intense anti-fraud measures. I also want to add that just nationally, we know from research that there's not a lot of fraud in public benefits. Public benefits are really hard to get. Like a CCAP application, I've never had to fill one out, luckily or fortunately for me, but they take like 18 hours to complete. That's a lot of time to put into an application to get a very small amount of money in benefits, right? So just generally, benefit systems are not plagued by fraud in the United States, according to the data that we have.
So what are we looking at next? What are we watching for?
So what we're looking for next is we are hoping that the 5 states that filed the temporary restraining order will file a preliminary injunction, which means that the freeze will be stopped. This is an ever-evolving kind of situation, though, and new things come up every day. So we may be looking at what, during the court hearing about our TRO, the lawyers referred to as operational chaos, where we're just not sure what funding streams we're going to be getting at what point, when they'll be frozen, and when we'll be getting them. And this is probably true across programs. So for me, the long-term play, I think here, especially in Colorado, is to create some kind of public investment in our childcare system that is not dependent on the federal government. And I think this is important not only for the operational chaos that I mentioned, but also because in Colorado, we have different values here than the federal government has. So, for example, there was action that the federal government tried to take to stop undocumented immigrants from accessing Head Start. Well, here in Colorado, we believe that undocumented immigrants are and should be able to access the same educational opportunities as citizens. So if we had control over those dollars, we would be able to open up our systems to all the kids who we think deserve service as Coloradans who value everybody who lives here. So the short-term play is a lawsuit. The long-term play, I think, is increased public investment.
So that would come from, say, like local tax dollars, or like how would we fund it if we didn't want to have to depend on these federal dollars?
So that's a really cool question right now, because in 2025, just in the fall, there were a bunch of local areas in Colorado and counties that successfully passed local tax measures. So these were things like lodging taxes. I believe there was a sales tax measure as well. Lodging taxes are especially interesting because they're paid for by tourists. So they don't necessarily impact Coloradans necessarily. And I think there were 8 measures that went up to a ballot, and the majority of them passed. So I think this just really shows that Coloradans are really looking for ways to support childcare. And although it's a really hard time to talk about taxes because the economy is in the shape it's in and we're all trying to stretch our dollars, I think that people realize that paying taxes towards childcare saves them money in the long term. So it is a really hopeful time to be thinking about revenue-raising measures like this.
Do you think that we could see something like this on our ballots in the next, I don't know, say 2 years?
I don't know, but I hope so. I think a lot of advocates are definitely hoping so. And I think another thing that we might see is that, budgets are statements of our state's priorities, right? So there might also be sort of a rearranging of priorities so that there is more money put in the state budget from existing funds. I'm really hoping in the next 2 years that we see one of those things. And I think at the campaign, just the children's campaign where I work, really supports either one of those, but especially like a revenue raising measure.
Well, Madhur, thank you so much for explaining this. This was really helpful.
Thank you. And thank you for covering this. This is such an important issue. And I think people who don't have kids don't necessarily realize how much it affects them. So I just really appreciate the opportunity to be able to talk about it.
Oh, and Mathu wanted to clarify that here in Colorado, though the majority of the childcare workforce is almost entirely women and disproportionately women of color, the majority of providers are white. And we want to know what you think. Are you a parent or a childcare provider navigating this system in Colorado? Give us a call on the What's Up with Childcare hotline at 720-500-5418. Again, you can leave us a voicemail or send us a text to 720-500-5418. That's all for today here on CityCast Denver. If you enjoyed this show, why not take a minute to tell your preschool teacher about us? Rate the show wherever you get your podcasts and subscribe to our morning newsletter and learn more about us at denver.citycast.fm. We'll be back tomorrow morning with more news from around the city. See you later.